Welcome to What Is, the channel where we ask the important what is questions. And today's question is, what is the NHS? Today, we're diving into a topic that's fundamental to the healthcare of millions. The NHS, or the National Health Service. You've likely heard the acronym. But what exactly is the NHS? In this video, we'll explore its fascinating history, break down how it actually works, celebrate its incredible benefits, acknowledge the challenges it faces, and take a peek at its potential future. History of the NHS. To really get a grip on the NHS, let's take a little trip back in time. Imagine a world before it existed. Access to healthcare was often determined by your wealth. If you were poor, getting sick could be devastating. After World War II, everything began to change. The destruction was a real eye-opener, showing us just how badly a fairer system for everyone was needed. The vision was super simple but totally groundbreaking. Healthcare for everyone, no matter what you can afford. And so, on July 5th, 1948, the National Health Service was born. Its founding principle was that healthcare should be free at the point of use, funded by general taxation. This was a monumental shift. Over the decades, the NHS has seen many key milestones, from the introduction of the cervical screening program in the 1960s to the development of the 999 emergency services, the introduction of the NHS Direct Helpline, and more recently, the establishment of NHS 111. Each step has aimed to improve access and quality of care. What is the NHS? So, what exactly is this entity we call the NHS? At its core, it's a comprehensive public health service. This means it's designed to provide a wide range of health services, from routine checkups to complex surgeries, all funded by the government. How is it funded? Primarily through general taxation. That means everyone who pays taxes in the UK contributes to its upkeep, creating a collective pool to fund healthcare for all. And who does it serve? The NHS serves the entire population of the United Kingdom, England, Scotland, Wales, and Northern Ireland. Though each country has its own separate NHS structure, this means if you're a resident in the UK, you have access to NHS services when you need them. How does the NHS work? Now, let's get into the nitty-gritty of how it all operates. Healthcare is delivered through a tiered system, starting with your local GP. Your general practitioner, or GP, is your first port of call for most non-emergency health concerns. They retrained to diagnose and treat a wide range of illnesses and can refer you to specialist services if needed. Think of them as the gatekeepers to the wider NHS. If your GP determines you need more specialized care, they'll refer you to a hospital. Hospitals are where you'll find a vast array of services, from accident and emergency departments to specialized clinics, surgery, and inpatient care. But it's not just GPs and hospitals. The NHS also includes a vast network of other healthcare providers. This includes dentists, opticians, pharmacists, mental health services, ambulance services, community nurses, and many allied health professionals like physiotherapists and occupational therapists. Benefits of the NHS. The benefits of a publicly funded healthcare system like the NHS are profound. The most significant is universal access. It means that your health isn't determined by your wealth. Everyone has the right to receive medical care. This leads to better public health outcomes overall. By providing preventative care and early intervention, the NHS helps to manage chronic diseases and prevent serious illnesses from escalating. Let's look at a couple of examples. The NHS's vaccination programs have been instrumental in eradicating diseases like polio and significantly reducing the impact of others, like measles. Organ transplantation services, while complex, have given countless individuals a second chance at life. all without the barrier of exorbitant costs. And during times of crisis, like the recent pandemic, the dedication and resilience of NHS staff shone through, demonstrating the vital role it plays in protecting the nation. Challenges faced by the NHS. Of course, no system is without its challenges, and the NHS is no exception. One of the most talked about issues is waiting times. For certain procedures and specialist appointments, waiting lists can be long, impacting timely access to care. Funding is another constant consideration. While funded by taxation, the demand for healthcare services continues to grow, driven by an aging population and advancements in medical technology. This puts a strain on resources. Staffing is also a critical area. The NHS employs a vast number of dedicated professionals, but there are ongoing efforts to recruit and retain staff, particularly in specialized areas and in response to increasing workloads. How are these challenges being addressed? The NHS is constantly innovating. This includes investing in technology to improve efficiency, exploring new models of care delivery, focusing on preventative health to reduce demand, and implementing strategies to support and expand the workforce. The future of the NHS. Looking ahead, the future of the NHS will likely involve embracing technology even further. Think of advancements in artificial intelligence for diagnostics, personalized medicine, and remote patient monitoring. There's also a growing emphasis on integrated care, where health and social care services work more closely together to provide holistic support to patients. Preventative health will also remain a key focus, aiming to keep people healthier for longer. The NHS will continue to evolve, adapting to the changing needs of the population and the advancements in medical science, all while striving to uphold its founding principles of fairness and accessibility. Conclusion. So, to recap, the NHS is a remarkable public health service, born out of a desire for equitable healthcare. It's funded by taxation, serves everyone, and works through a network of GPs, hospitals, and countless other healthcare professionals. While it faces challenges, its benefits in terms of universal access and improved public health are undeniable, and its future promises further innovation. This short video by no means covers the entirety of the history or scope of the NHS. What are your thoughts on the NHS? Do you have any personal experiences or questions you'd like to share? Let us know in the comments below. If you found this video informative, please give it a thumbs up, share it with your friends, and don't forget to subscribe to the What Is channel for more deep dives into the topics that matter. Thanks for watching.